problems and how we react to these problems are what create the crisis.
Hello, everybody, and welcome to another episode of The Force for Good. Today, I'm excited to have our first guest, who is actually from the southern United States. I met Christopher Allen as we were really beginning to do some early conversations about PM Plus and bringing Problem Management Plus into the United States. And Christopher and I actually met on LinkedIn, and I persisted a bit because Christopher is an incredible human being, well connected in so many areas that I am not really familiar with. And so what I'd like to do is introduce Christopher Allen. And Christopher, welcome. I am so happy you're here.
Thanks, Rick.
I'd like to turn it over to you. And if you could do an introduction of who you are, the work that you've done, and the networks in which you're connected.
Awesome. So Christopher Allen, I just retired from the Army National Guard in April of 2025. But before then, I got my start in the Navy back in 1988, down in Charleston, South Carolina, where I met my wife, Lisa. We've been married, it'll be 35 years this year.
Nice.
Congratulations. So thank you. And so did that for 6 years, got out, said I was never going to, not that I had bad experience in the military, but just, I did my time. I wasn't planning on going back in.
Yep.
So I was out for 10 years, mainly doing, I started out doing electronics and doing commercial satellite dish systems for like schools and hospitals and whatnot. And then transitioned, doing a couple of other things, got into mortgage underwriting, did that for a long time. And then 9/11 happened.
Oh, okay.
And that, got me thinking about going back in the service. At the time, I was still young enough. I was still, viable to go back in, but I didn't want to go back in active duty because during that 10-year break, we had 4 children. And so in 2006, joined the Army National Guard in South Carolina and was doing that work. And in 2006 and 2010, I started working for the National Guard doing line of duty injury cases, which is basically like the Army's workman's comp. Is the best way to explain it. So you document, any kind of service connected injury. And then, if it's severe enough, it helps them with their disability rating with the VA. And I did that for 6 years. And then I got a phone call from the suicide prevention office asking me if I wanted to switch from the office that I was in, line of duty injury cases, over to suicide prevention. And so I made that switch in 2016. And that's really what got me on the path. I mean, I changed my college path at the time from business to psychology at the time, and started getting trained in different suicide prevention workshops, like Living Works Assist was the first one I got trained in. And then Living Works Safe Talk. I've been trained in mental health first aid. I became a master resiliency trainer for the Army. And so I did that for about 3 years. And then COVID hit. So in the beginning of 2020.
Sure. That would have been all pre-COVID. Yep.
Yeah. COVID hit and we couldn't do any in-person training anymore. And you can call it fate, you can call it coincidence, you can call it whatever you want. But about 6 months before COVID hit, Living Works had launched a program called START. It was online suicide prevention training. And so we couldn't do in-person training anymore. So we were switching everything over to the new program that we had invested in, which was START. We started doing, online training. The user, the learner logs in, they do the suicide prevention training, they get a certificate, then they would send it to us. And that's how we would track our suicide prevention training, because we couldn't do in-person training.
Okay.
And then uh, COVID hit. Um, a lot of other National Guard states wanted to do what we were doing, so we started branching out to other states with the START online program, suicide prevention training. And then NGB, our national headquarters for the National Guard, saw what we were doing and wanted me to come up there. So I went up to our national office for 3 years to branch START out across the country. Um, I did that for 3 years. Then I came home, and right before I came home, DoD had launched the Integrated Primary Prevention Workforce,
And
and
DOD is the Department of
the
Defense.
Department of Defense,
Okay.
and so I switched from doing suicide prevention, which is response and training, in the moment. I
Okay.
switched over to integrated primary prevention because it's upstream approaches to get ahead of lots of harmful behaviors, to include suicide, um, drug and alcohol abuse, sexual assault abuse, domestic violence abuse, trying to get ahead of all of the harmful behaviors in the military.
Sure.
And so I say all of that to say I've seen a lot of different types of training out there in the world, from in person to online to everything in between. And there's a lot of great technology out there,
Yes.
but technology is never going to replace person to person, small group training for suicide prevention. That's my opinion.
Love that.
And then
Love
so
that.
I stay on LinkedIn, I see all of the things. And like Rick said, he reached out to me talking about this PM plus. I'm not sure what, Prime Minister plus meant. I don't know. So I
Love it.
blew him off for a long time, for several months. And then, like he said, he finally got me into the training, problem management plus, and it just clicked. Right. So, in one of the trainings that we do in the military, master resiliency training, there's actually a whole segment, a whole um, skill set around problem solving.
Yep.
Because when folks have life stressors heaped upon them, they, through their coping mechanisms, sometimes don't make the best decisions. If they're
Exactly.
drinking to
Yep.
cope, if they're doing drugs to cope, prescribed or illicit, if they're just making bad life decisions, a lot of times it comes back to not being able to problem solve.
Right.
um, and so we train that skill to help service members. And so problem management plus, going through it, one, I mean, I told Rick probably every day that we had training that I loved that it was one in person and that it was real time,
Nice.
because suicide prevention training and resiliency training and problem solving, the problem solving skill set was actually, it's the longest skill set that we train in master resiliency training. It
Oh,
is not
interesting.
it's not a quick process, right? So when
Right.
you're sitting down eyeball to eyeball with someone, it just takes time. And it's hard to convey that to folks sometimes. They
Yes,
say,
I
well, why
totally
can't you
agree.
just teach, the skill in an hour? Our unit only has an hour to do this training. Can you just get it done in under an hour? And I'm like, I can tell you what the skill is in an hour, but I cannot train it in an hour, right? It just takes more
Yes.
time.
Yes.
And so when we were going through problem management plus, we did the course in real time. I liked that we
Yes.
went through, the workbook and the training, and getting the knowledge of what we were going to do. But then in the practical exercise, it was real time, because it has to be, in my opinion, right? In this world where we want everything done right now, what you
Yes.
cannot rush is a conversation between one human and another human, right? And so
Yes.
it just, you're building that relationship of trust when you first start working with someone. That takes time.
Yep.
Um, they start to open up, they trust you, then you teach them a skill on how to manage their problems, problem management,
Yep.
and it's just a process, and you go through it for a period of time, and eventually the hope, you as the helper and the in my case the service member, you hope that it clicks with them.
Yes.
And
Yep.
so
Yep.
then, eventually that clicks in their brain, and more times than not, I'll hear back later that, their quality my goal is to improve the quality of life of our service members and their families.
Right.
And when they come back and tell me, whether I'm teaching master resiliency training or suicide prevention, and they say that it worked, you know, it makes your heart swell, right?
I
Um,
agree.
so that's
It's the
that's the
passion for
reason
the work.
why, yeah, that's the reason why I'm in this work. And whenever I took problem management plus, it just naturally clicked with what I was already doing, and what really the world, especially our service members, what they need right now.
Christopher, what in what ways in all of the networks, because I think about all of the work that you've done specifically in the whole suicide prevention network, and thinking about PM plus, problem management plus, in the prevention. One of the things that really excites me about PM plus is that to me, it seems so far upstream, and we've used that language professionally forever, right? Someday we'll get upstream. Someday we'll get upstream, and and that we truly have something from the World Health Organization that has worked tremendously in 20 different countries, and now we're trying to bring it into the United States. Thinking about, especially somebody of your caliber with your level of experience, how do you see this as truly upstream in both prevention and postvention work?
Right. So, I work in integrated primary prevention, and primary
Yeah.
prevention is not a term that just the average person, you know, Joe Public knows, right?
No,
And
I agree.
upstream, obviously, I won't say obviously. Upstream is a term that also is not used in our regular vocabulary in the world.
I
Um,
agree.
and so what happens is when someone dies by suicide,
Yep.
civilian or service member, um, leadership, their immediate reaction is, what could we have done different? And they want an answer right now.
Yes.
And so I will tell them, I was like, we need a better system. And so it's really the small things, but it's the small things in the very beginning, right? If I was, able to make something happen right now, I would revamp how we onboard, our military personnel or civilian workforce, right? When somebody comes into the job,
Yep.
they are indoctrinated into how things are done in that organization, right? And
Correct.
so
Yes.
in the military, when we bring them in, we they go through basic training, right? Basic training.
Yep.
They
Yep.
learn all of these basic skills. Well, a basic skill that, in my professional opinion, needs to be worked on more is, you know, bad things have a potential to happen, in the military, but even in life, right? So let's just look at just the human condition for a while. So bad things are going to happen, traumatic things are going to happen in somebody's lifetime. If they live long enough, they have life experiences, and it's how we
Adversity is going to
react
meet all of us every day.
every day. So,
Every day.
I tell them, we need to teach these skills before the crisis happens, right? When
Oh,
somebody attempts or dies by suicide, we are in response mode there. We're not in upstream. We're not in primary prevention at that point. We are totally in response mode.
yes.
How do we get we say, how do we set things up before the crisis? And it really does come down to basic training in the aspect of, like we just talked about. problems and how we react to these problems are what create the crisis.
Yes.
If we can get
Yes.
ahead of that and teach people how to deal with the crisis before, like in the training that we did, one of the scenarios that we went to is, if somebody knows that something, problematic is going to happen, in their future, you know, pre-plan on that. If you know that
Yes.
you're going to walk into a potentially triggering environment, what can you do before then? How can you control your breathing in that moment? How can you control your mind in that moment? And even to the point of, what can you imagine is the outcome of this trauma or crisis? And how are you going to respond to it? It seems simple, right? But, if you don't ever train it and then this crisis happens in someone's life and they're not prepared for it, humans do what humans do and they're going to react. And
Right. And
unfortunately
it's
in our
like,
country, about 50,000 people decide to, because of the trauma and because of the pain and many other reasons, they decide to take their own life. So
yes.
my experience is, let's get ahead of the crisis and do the right type of training.
And I totally agree with you. And I think maybe more common kind of language is thinking about how do we get ourselves into a position that we're proactive rather than reactive. And we know as human beings, if we can learn skills in basic training or in everyday life while our stress is low, we're going to and practice those skills. It's like learning a foreign language. If we're going to just immerse ourselves, we probably aren't going to do so well with the foreign language. If, however, we practice that and practice while we're still in a calm state, we're going to retain that. And then our brain is going to be able to pull up, oh, this is that managing stress thing. What I need to do is start paying attention to my breathing before, or this is managing problems, or this is how I strengthen my social supports. Um, all of those things proactively so that when adversity does happen, and I in the military world, in the world of suicide prevention, really thinking about how do we teach this before somebody gets actually into that situation so that when it begins to happen, and one of the greatest challenges of course is how do you measure that we're doing better,
Right.
and that's not always easy to measure.
Well, you're right, and so that's another thing. When leadership, they want the data, right? They want the numbers, and
Exactly.
so if you they correlate, a program doing well to less suicide and less suicide behaviors. That's unfortunately not always the case. And you mentioned,
Right.
the connections on LinkedIn. So what I've been doing for the past probably year and a half is, using LinkedIn. I mean, I had a LinkedIn account. I wasn't really using it, but I started using it because I'm not the only one that sees this. I'm not the only
No.
one. I didn't invent upstream approach. I didn't invent primary prevention.
Yes.
But so I just started putting, messages out there. And first and foremost, in any platform that I've ever used, I made it a goal from the very beginning that I would only put positive information out.
Congratulations. Love it.
Thank you. And so, I put these messages out and then they resonate with folks. And, you're talking about, connections and where PM plus, might fit into that. So the more connections that I've made talking about primary prevention, a lot of people don't know about it, right? So then they want
Agree.
to know more about it. And so,
Agree.
they don't, maybe they've heard the term upstream, but they don't really know what that means. And so I've had lots of people connect. And so I'm just doing my part to raise the awareness of what that is. And then something magical happened, right? I
Yeah.
started connecting with folks that were decision makers in different parts of the world that we work in
Yes.
psychology, in resiliency training and suicide prevention training. A lot of like-minded people are coming together. And then my thing is connecting, just making more connections, right?
Yes.
So we talked about, the Real Mental Health Foundation.
Yes.
We've talked about suicidetalk.com. We've talked about Patrol Base Abate. We talked
Oh, yeah.
about the Realms of Asgard, which is online gaming mental health,
Oh,
incorporated into
okay.
their gaming. And so by making all these connections and then bringing PM Plus into it, I'm not trying to boost your ego or anything like that, but I haven't seen anything like Problem Management Plus out there right now. It's a gap,
And
right? And
yes.
so we had to
Yes.
find ways to get skill sets that are not being trained in front of people that need the training.
Yes.
And so
And
that's
that can be, they don't need to be mental health professionals.
nope,
We will never, ever, ever be able to hire enough professional people to meet the need. And
exactly.
frankly, if we teach the skills, we might be able to prevent people from actually getting to the point in which they may need a professional.
Right,
Because by and large, it's a deficit of a skill set, right?
right,
And and all we're really doing, and all we're really doing quite boldly, is taking something that lives globally and trying to bring it into the United States exactly for the reasons that you're talking about. And
right,
and I think we run a very parallel process in that I believe you're a connector of people and networks. I believe that's exactly my role as a connector. Um, and I think about, to be able to connect with your network, which is then in the suicide prevention, postvention, the military. You're now part of the real. You think about all of those networks and all of those people, and I think you're spot on when you say we need to get in front of the people and talk about a skill set and tools that can be used proactively, and use the language of the specific audience that we're facing.
right. Because, y- like in our school systems, we used to teach basic, like skills, like,
Right,
you had home ec, you had shop, you had all these life skills. We don't really do that as much, not in the same way that we did maybe when you and I were growing up. But
right.
even in the school systems, just teaching basic life skills, problem solving, in my opinion, is a life skill, right? And
I
some
totally agree with you.
and
Yep.
so some people, if I'm not saying that kids don't have problems because they absolutely do, um, but they use different coping mechanisms, and some are good coping mechanisms, some are not so good, and so it's like with CPR. You don't uh, sometimes even know why you're doing CPR, but you want the training, and maybe in your whole lifetime you'll never perform. I've never performed CPR on a person in my life,
Right.
but I've been trained on CPR. Every now and then I update the training just to see what the latest thing is. Um, and maybe I'll never use it. But look at how many lives have been changed using that basic skill, from somebody having a heart attack and then having somebody in close proximity that's trained in CPR. And
Right.
now we have AEDs, on the walls in most businesses. The same thing with PM Plus. But the thing with PM Plus is everyone has problems.
All of
It's
us.
how we react to those problems that's going to lead us down different paths. And we want people to live their best quality of life that they can. And if problems, we talked about it in the training, if a certain problem is causing you not to live, your highest quality of life, how can we help you work through that problem. The problem might not go away, right? It might be part of your life.
Right. Right.
So how are
We're
we
not
going to
teaching
how are we
anybody how to solve anything. We're teaching people how to
absolutely.
manage.
Exactly. And that I loved that part of the training because,
Yes.
you know, if you don't like it when it rains, are you going to stay inside when it's raining outside?
Uh,
It's last night, here in South Carolina, it was 19 degrees or 17 degrees last night. For our
yep.
part in your neck of the woods, that's a spring summer day. Around
Yep.
here, it's miserable, but I'm still gonna go outside, but I know I'm gonna have to put on gloves and a jacket and all that, and that to me, that's what PM Plus does,
Yes.
is it helps you see the problem for what it is, prepare for it, put your
Yep.
jacket on, put your gloves on,
Yep.
um, and then go out and face the problem and mitigate it as much as you can,
You're
but
not
live
going to
above the
change the
line.
weather.
You're not
You're
gonna
not going to
change the
change the
weather.
weather.
You're not
Yes.
gonna do it.
Yep.
Yep.
Christopher, if you think about one area in which you would hope PM Plus could have an impact in all of the work and all of the networks that you're connected with, what would be your number one pick?
So I'm gonna cheat a little bit. So my number
Yep.
one pick would be, at the beginning and at the end of someone's military career, whether they come in for 4 years or 2 years or whether they
Oh,
stay in 40 years, teach them, um, problem management plus in the beginning, like
yep.
in the basic and the reason why I say in basic training, it is basic training, but it sticks with you through your whole career. I mean, just saying
Absolutely.
just saying basic training and boot camp in my brain right now, it immediately takes me back to 1988, being in front of my instructors at that point, teaching basic skills.
Yep.
And then I would want it throughout the career training, but definitely before they leave the military, however much time they've served, I don't care if you've served 1 year or 41 years.
Yep.
Teach this training again before they go out into the world, um, so that they can live a higher quality of life. That's
I
when
love it.
somebody leaves the military, there's a couple of there's times in a service member's career where it becomes where they're more at risk of not just dying by suicide, but also just not coping very well. So,
Exactly.
when you come in the military, it's a change. It's for some people, I mean, it's a shock to the system. They've never been through it like this before. They go through basic training. It's a big thing. Um,
Yep.
when you deploy, especially if you deploy into another country, and especially if there's combat going on at the time, when you come
Yep.
back, that adjustment is a very hard adjustment for a lot of service members.
Yeah, I can't imagine.
And then when you get out of the military, the transition from being a military member to a civilian is can be a traumatic transition if you don't transition well. If you don't find, in the military, it gives you purpose and direction. When you
Yep.
leave the military, you basically have to find your own purpose and direction, and that's
Exactly.
a hard transition sometimes.
I agree.
So,
I agree.
and we do have training that does help somebody transition from the military, but and I just transitioned out of the military in April, and it was all great training, um, that we went through, but nothing was up focused around, problem management.
Yes.
There's going to be problems.
Exactly.
Now, for me, I already had a civilian job, so it was an easier transition for me. But for a lot of people, it's a very difficult transition, and one of the ways that they cope is, drugs, alcohol, risky behavior, and some of them make the decision to die by suicide, versus going through that to them is a very painful transition sometimes.
Agree.
So
Christopher,
that's what I would do.
I can't I can't thank you enough. We're going to stay connected. I know it. I appreciate that you put up with all my persistence. I think you're an incredible human being. I have deep respect for the work that you're doing, the networks in which you're involved. Um, I know that these networks, your network, this network, we're just going to keep connecting because the work is too important to ignore. So I want to thank you for your time.
Thank you. And
And
then the
again,
feeling
thank
is
you for everything that
absolutely
you're doing.
mutual. Yes.
Yeah,
Thank you
thank
for
you.
what you're doing.
Thank you. Um, that's going to do it for this episode of The Force for Good. And like always, I invite you to join us in being a part of The Force for Good. Thanks, everybody.